The Queen Elizabeth Hospital in Charlottetown is planning to purchase 3 more specialized blankets called biliblankets that use light therapy to treat jaundice in newborns. The hospital currently has 2 biliblankets, but needs more. This is a condition that a lot of babies have, said Kathy Larter, the nurse manager of the P.E.I obstetrical department. When babies have too much bilirubin in their blood, it can be harmful, and the light in biliblankets is used to break it down, just like sunlight. She said, the whole goal is to treat the baby, but keep mother and baby together. Larter said, she said even with 5 blankets, the neonatal intensive care unit (NICU) could use even more in weeks when there are lots of babies born. Lindsay Metzger just gave birth to baby Eleanor Quinn Metzger, who needs to be treated for jaundice. Metzger said she is grateful the QEH has biliblankets available. They look like a soft flexible mattress with lights inside. Essentially it just has a light underneath and the baby just kind of sits over top of it. You can cover her with blankets, Metzger explained. She's cozy, she's doing great, she doesn't seem to be minding it at all. Biden says platforms answerable for content. Brooks family lawyer blasts officers rehiring. Biden focuses on restaurants hit by pandemic. U.S. Navy sailor puts training to work in boat rescue. Walensky could see virus decline by end of July. AP top stories May 5th. Space travel grows 20 years after first space tourist. Ford raises stake in Colorado battery startup. Today in history for Monday, May 5th. Dems push waiver for vaccine production overseas. House GOP leader decries wokeness in MLB move. SpaceX launches Starlink satellites into orbit. Man killed by deputy recalled as good guy. Loving Washington state pausing reopen after virus spike. Detroit goes door to door to promote vaccinations. Some immigrants lose homes in pandemic economy. Metzger, who is a nurse practitioner, can cuddle and feed her newborn while she's being treated. Bonding is so important in the early days. Skin-to-skin contact is so important, and just being able to facilitate with the blanket is awesome. Metzger said, the blankets cost $6,000 each. The hospital will buy them with funds donated through the QEH Foundation's major annual fundraising campaign, which is focusing this year on raising money for equipment for newborns in the NICU. The foundation is pleased and grateful for donations for the blankets, said CEO Tracy Cummo. She said there are many more needs in the NICU like beds and equipment for feeding and monitoring newborns. For instance, specialized medication scales cost $7,000. Load error. This is life-saving equipment, Cummo said. We really need donors collectively to help fund those high-priced items. We do not want to have to travel off-island for care. Many donors have a personal connection to the hospital, like Wendy Wittenberg and Tim Robb of Mobile Market Research, who donated to the Billy Blanket campaign because their son benefited from one at another hospital. We were very dependent on it, and when we saw the picture it immediately reminded us of Alec and how he looked the first 3 weeks, said Robb. Thanks to such donations as well as developments in neonatal care, more sick and preterm babies born after 30 weeks gestation have been able to stay on P.E.I. the last couple of years. Larter said, the NICU has been able to keep about 50 babies on the island that normally would have needed to be treated out of province. We want to keep our families here on P.E.I. We want to keep mothers and babies together, so this equipment is allowing us to do that. Larter said, the foundation buys most of the equipment at the hospital, and this is a big month for its campaign. It's holding an online telethon it is calling a stream-a-thon May 30th, and Cummo said the foundation hopes that will raise $600,000.